Emergency. An ambulance is arriving. We have a pregnant patient. The announcement shattered the stillness of the late night, echoing throughout the hospital. With cleaning supplies in hand, I froze for a moment. Ambulance calls were nothing new, yet an uneasy feeling welled up in my chest. Seconds later, the hospital doors burst open and a stretcher was wheeled in. A pregnant woman was lying on it. When I saw the woman holding her hand beside her, my heart sank even further. Michael, my sister Emily, spotted me and ran over. Her eyes were bloodshot and filled with tears. "Please, save her. She's my best friend." Emily's desperate voice snapped me back to reality. But at the same time, a different memory burned in the back of my mind. The moment during Emily's surgery. Red blood pouring out, staining the operating table bright crimson. My hands trembled, cold sweat trickled down my face. The more I panicked, the worse things got, until my mind went completely blank. Damn it, the bleeding. It won't stop. Can I save this patient too? Or will I make the same mistake again? Maybe I can't do this. I'm not a doctor anymore. I kept telling myself that. Around me, the medical team moved quickly, preparing for emergency surgery. It was clear the patient's condition was deteriorating, but there was no one available to perform the operation. No one. No one would help. Then, even as my whole body trembled, I took a step forward. This time, could I save her? No, I have to save her. My name is Michael. I'm 38 years old and a former surgeon. Since childhood, I was known for my high IQ and natural talent for academics, especially in science. I was the kind of student who could skim the textbook the night before a test and still score perfectly. People would say I was on a different level, and teachers had high hopes for me. I lived up to those expectations and went on to medical school. Studying medicine never felt like a burden. In fact, the deeper I explored the medical world, the more fascinated I became, throwing myself into it as if testing my own limits. Even in university, I ranked at the top of my class, and being called a genius by classmates and professors was the norm. After graduation, my reputation as a surgeon only grew. I had a sharp ability to assess even the most complex cases and make calm, precise decisions, earning praise from everyone around me. Eventually, I became known as the genius surgeon. I specialized in high-difficulty surgeries that most doctors hesitated to take on. Even in cases where tumors were tangled with nerves or blood vessels, I could make the first incision without hesitation. In delicate procedures, I showed no signs of faltering. Every cut and stitch was executed with precision. My focus in the operating room was intense, as if time itself had stopped, with my entire attention locked onto the patient in front of me. "Michael can handle it." That phrase became a common reassurance, not just among colleagues, but also among patients and their families. I witnessed it many times. Just hearing that Dr. Adams would be operating brought visible relief to anxious families. That trust wasn't just based on my surgical skill. It came from thorough preparation and planning. Before any operation, I would study the patient's chart in detail and run countless simulations. For complex cases, I used the latest imaging technology and 3D models to plan each step of the procedure down to the minute. My approach was to anticipate every possible scenario, to be ready for anything. But that wasn't all. As a doctor, I always made an effort to ease my patients' fears. When I talked to them before surgery, I avoided medical jargon and explained everything in the simplest way I could: what would happen and what the risks were. I did everything I could to make them feel I can trust this person with my life. In the medical field, the weight of life is always present. As a surgeon, I knew that my skills and decisions could determine a patient's future. That's why, whenever I stepped into the operating room and picked up the scalpel, I made sure I was free of hesitation or doubt. There was only one thing in my mind: the unwavering resolve to save the patient. But all that confidence and trust shattered in an instant during Emily's surgery. She had been born with a heart condition, but she'd lived a normal life without any major issues. Then one day, when she was 33, her condition suddenly worsened and emergency surgery became necessary. Because Emily specifically asked, "I want my brother to operate," I agreed to take on the surgery. To me, Emily is irreplaceable family. After we lost our mother early, and our father was always busy, she was the one who kept our home together with her bright spirit. I wanted to save her no matter what. With that determination, I entered the operating room. But I made a fatal mistake. I damaged a major blood vessel. Bright red blood spilled across the table, staining everything in sight. That scene is forever burned into my memory. Damn it! Stop the bleeding. It won't stop, I shouted, trying to refocus my hands. But the more I panicked, the less control I had over my fingers. Sweat dripped from my forehead, soaking the inside of my mask. Cold sweat ran down my back, and my heart pounded in my ears. My hands shook as I gripped the hemostat, unable to operate it properly. Emily's blood kept flowing, unstoppable. With each drop, my confidence was stripped away. "Stay calm," I whispered to myself, but the turmoil in my heart wouldn't stop. Emily's smiling face kept flashing through my mind. She's going to die because of me. That thought took hold of my entire being, and my hands trembled even more. My vision blurred. I couldn't tell if it was sweat or tears. My fingers, still clutching the scalpel, went numb and cold, and my mind went blank. At that moment, "Michael, step back." Ryan's sharp voice snapped me out of my daze. Ryan is the head of this hospital and a veteran surgeon. He has saved countless lives, always making precise decisions during every operation. Because it was a family member's surgery, he had been present as backup, just in case. But I have to do it. I tried to object, forcing the words from the back of my throat, but they lacked conviction. When I looked at Ryan, trembling, he was staring straight at me with calm, unwavering eyes. "The patient comes first. Let me take over." Those words pierced my chest like a blade. Gritting my teeth, I reluctantly stepped aside. With each of Ryan's instructions, the atmosphere in the operating room grew more focused. The nurses' movements became synchronized, and the hopeless situation began to shift. But what rose up inside me wasn't relief, it was despair. I had failed as a doctor. That thought echoed in my mind, pulling me into a deep, bottomless darkness. What if I couldn't save Emily's life? Maybe I didn't even deserve to be in that room. Eventually, thanks to Ryan's calm judgment and expert hands, the surgery was somehow a success. Emily's life was saved because of Ryan, and it was because of me that her life had been in danger in the first place. That unshakable guilt weighed heavily on me. Sitting in a chair, I just stared at the scene in the operating room. Ryan, checking on Emily's condition, stood tall and steady, so different from me. The bitterness and deep despair clenched my chest, and I couldn't utter a single word as I gripped my fists. After that day, I could no longer hold a scalpel. Every time I reached for one, the tremor and fear from that day came rushing back, freezing me in place. These hands, meant to save lives, might only bring danger. With that thought, all my confidence disappeared. I gave up being a doctor and was hired as a janitor at Ryan's hospital. Now I spend my days gripping a mop, moving mechanically. That's the only way I can still be involved in medicine. As I mop the white hospital corridors, memories of who I used to become flooding back. Back when I was a genius surgeon, and the words "thank you" from patients saved me. Now, doctors casually say things like, "Must be nice having such an easy job at your age." Even patients joke with a smile, "Being a janitor must be tough too, huh?" To them, it's just light-hearted teasing, but to me, it cuts like sarcasm. But there was one person in this hospital who didn't see me as just a janitor, she saw me as a person. Ashley. She looked stunning in her white coat. her gentle smile and composed manner earning the trust of both patients and staff. Her presence alone seemed to shift the energy in the corridor as she walked. "Thank you for always keeping everything so clean." Just a simple remark in passing, but her voice had a way of cleansing the heart, and each time I felt a small warmth rise in my chest. But to her, I was still just a janitor, nothing more. I kept telling myself I no longer had the right to be a doctor, so I kept pushing the mop forward, numb and empty. One night, when Ashley was on duty, I was cleaning the quiet hospital as usual, mop in hand. The silence of the night made my loneliness feel even heavier. But that night, something felt different, something was off. "Emergency. An ambulance is arriving. We have a pregnant patient." A tense voice rang out from the hospital speakers, piercing the stillness of the night. I stood frozen, still holding my cleaning supplies. Normally, I'd ignore it and return to my work, but this time, my feet wouldn't move. The doors to the ambulance bay burst open, and a pregnant woman on a stretcher was rushed in. Beside her, holding her hand with a terrified expression, was Emily. Emily? The name slipped out before I realized. She turned toward me. In that instant, a strange stir rose in my chest. Fear and desperation were etched into her face. "Michael, this is my friend. Please help her." Emily ran toward me, recognizing me. "I'm not." Before I could finish, the voices of medical staff filled the air. "The patient has a placental abruption. Heavy bleeding. Where's the obstetrician? They're in surgery, won't make it in time." I could see it, this woman was in real danger. But I still couldn't move. I could still feel what it was like to hold a scalpel. But ever since Emily's surgery, these hands had only brought me pain. Emily ran after the stretcher as it was rushed toward the operating room. I remained frozen in place. My chest tightened. The pregnant woman, Emily's friend, already looked pale when I saw her earlier, and her lips had turned bluish. "Prep the OR." Ashley's voice echoed through the corridor. She clutched the patient's chart, giving orders with a tense expression. Even in her voice, the anxiety was clear. Her eyes darted over the chart, glancing up now, and then to read the expressions of the staff. What am I doing? Am I just going to stand here and watch again? The question rang out inside me. My vision blurred. Emily's desperate face rose in my mind, and something deep inside me screamed. But still, I didn't move. The OR must have been nearly ready. Staff bustled around, and Ashley stood by the stretcher, checking the patient's condition. She gently touched the woman's arm, but her expression showed hesitation. "Dr. Stevenson, can you perform the surgery?" one of the staff asked. "I can't," Ashley faltered. Her hand trembled slightly. She couldn't get the words out, just stared at the patient's face. You could see the conflict within her. She wasn't sure if she could save the life in front of her. I knew that feeling. I had been there myself, and I could see how that fear was paralyzing her. "Is there anyone else who can operate?" Ashley's strained voice was laced with urgency and frustration. But I could tell her frustration wasn't directed at anyone else. It was at herself. "Michael." Emily's voice snapped me back to the moment. She ran up and grabbed my arm, her eyes brimming with tears. "Please, with your hands, save her. She's my friend. If this keeps up." She choked on her words, and the sight pierced straight through me. I closed my eyes. The memory of nearly failing during Emily's surgery surged up again, and a cold sweat ran over my body. I answered, my voice trembling. "I can't. I'm not a doctor anymore. I can't hold a scalpel." "You can do it." Emily raised her voice. "Maybe you did run away back then, but I'm alive now, aren't I? I survived. What's the point in clinging to the past? You've saved so many lives, there's proof of that. Stop wallowing in guilt and save her." Her words felt like they blew the lid off something inside me. each word sliced through my chest like a blade. I looked once more at the operating room. Ashley stood beside the patient, her shoulders hunched, eyes cast down. I focused on the woman lying on the operating table. Her face was pale, her breathing shallow and uneven, and her stomach barely moved. But I could feel the presence of a life inside her. It weighed heavily on my chest. And then, another scene rose in my mind. The moment of Emily's surgery. Back then, I had been full of confidence. Even the most difficult operation, I believed I could handle it. But reality shattered that belief in an instant. The moment I cut a major vessel and triggered massive bleeding, everything fell apart. The blood-soaked table, Emily's fragile breaths. My hands trembled uncontrollably, drenched in cold sweat. I tried to issue commands through a quivering voice, but my mind had gone completely blank. What if I make the same mistake again? The thought of this woman ending up like Emily chilled me to the core. I tried to breathe, but my chest felt like it was clamped shut. But then Emily's tearful face came into view, and another voice echoed in my mind. If you run now, what happens? That patient, the life inside her, they'll die because you walked away. The or was on the brink of collapse. Ashley stood frozen, still clutching the chart in shaking hands. The other doctors were scrambling with emergency cases. None were available to operate. If I don't do it, what happens to this life? Each time I wrestled with myself, another cold sweat rolled down my back. Still, my eyes stayed locked on the woman's stomach. There was a life in there, real and waiting to be born. And I could feel the weight of it settle in my palms. No more running. You almost lost Emily. Do you really want to lose someone else again? As I argued with myself, her words returned to me. Please, help her. I couldn't resist that plea. I took a deep breath, and my feet began to move on their own. Clenching my trembling fists, I stepped beside Ashley. I'll perform the surgery. My voice was calm, shockingly calm, and unmistakably firm. For a moment, the chaos around us seemed to quiet down. The last shred of doubt inside me began to dissolve. Right now, all that matters is saving the life in front of us. What are you saying? Ashley looked up at me in surprise. Her eyes filled with confusion and fear. Her hands were still trembling ever so slightly. But as I declared I would take the lead, it seemed her shaking eased just a little. Are you serious? You'll operate? Her voice was tinged with disbelief. And understandably so. A janitor suddenly declaring he would perform surgery? I took a deep breath and met her gaze. I'm a doctor. I was a surgeon. I meant to say everything in those few words. But those words seemed to shock the surrounding staff as well, and a wave of murmurs spread through the room. It'll be fine. Ryan's deep voice cut through the tension like a blade. He walked over slowly, speaking quietly to Ashley. Ashley, trust him, Mr. Keller, but he's just a janitor. Ashley, clearly confused, turned to Ryan and voiced her concern. He glanced at me for a moment. There was certainty in his eyes. Then he turned back to her and spoke slowly. He was once one of the most brilliant surgeons in the field. Michael, you've never heard that name? Ashley gasped. Her eyes darted as if recalling something, but no words followed. Michael performed countless complex surgeries at a young age and saved many lives. But one day, he nearly lost someone important on the operating table and blamed himself. That's why he gave up the scalpel. Though his tone was calm, warmth seeped through Ryan's voice. Still, Mr. Keller. Ashley began to protest, but Ryan gently interrupted. But Michael's skill and experience are still intact. I'll vouch for him. There's no one more qualified right now. Ashley remained silent. She was clearly struggling inside. Then, finally, she exhaled deeply and looked me straight in the eyes. Understood. If Mr. Keller says so, I'll trust you. Her words cleared the last of my doubt. I gave a quiet nod and turned back toward the doors. There's no time. Let's begin the surgery. My words set the staff into motion. Ashley, still tense, followed close behind. In my heart, I made a vow. This would be the last time I let my past hold me down. By saving this life, I would reclaim myself. No more hesitation, only focus. Beyond the doors, the team was scrambling to finish preparations. The patient's vital signs on the monitor screamed danger. Michael. Ashley stood beside me, her voice slightly trembling. Please, truly, I'm counting on you. Her voice carried a mixture of fear and hope. I gave a small nod and turned my focus fully to the procedure ahead. When Ryan entered the operating room, the tension in the air heightened even more. His presence was commanding, bringing with it a sense of clarity, even amid chaos. Michael, let me say this again. Ryan looked straight at me. I'm entrusting this to you because I know you can do it. No one else is more capable of saving this life. His words struck deep within me. Ryan believed in me. That alone carried more weight than anything else. I took a deep breath, collecting myself. Understood. I'll do it. My voice was clear, free of hesitation. Ashley stood beside me, taking the instruments in hand. Her hands trembled slightly, but her eyes were steady. I'll support you however I can. That single sentence gave me even more courage. The surgical lights turned on, casting a bright glow over the room. As the battle for life was about to begin, I exhaled deeply and stepped toward the table. I will save this life, no matter what. With that vow in my heart, I took hold of the scalpel. The operating room was cloaked in tension. The only sounds were the steady rhythm of the heart monitor and the staff's quiet voices. I calmly put on my gloves and turned my eyes to the pregnant woman on the table. Ashley stood across from me, instruments in hand. Even in her movements, I could see traces of hesitation. When I glanced her way, she met my eyes for a moment. Michael, I'll begin preparing the instruments. Her voice was lined with determination, as if pushing back her own fear. Still, her hands revealed her inexperience. Understood. Thank you, I answered quietly. I chose my words carefully so as not to put any pressure on her. Creating an environment where everyone can focus, that too is the responsibility of the lead surgeon. Ryan stood by my side, watching quietly. His presence alone grounded me. Just having him there brought a small sense of calm. Michael, you remember the procedure? He asked quietly. Yes, no problem. As I gave that answer, memories from the past flashed through my mind once again. The failure during Emily's surgery, that moment of utter despair, came rushing back. But I fought to keep that shadow from consuming me. Focus only on the life in front of you. I repeated those words silently to myself. Scalpel. When I gave the brief instruction, Ashley handed me the instrument, trying to steady her trembling hands. There was still a hint of uncertainty in her fingertips. It's okay, I whispered in my mind as I took the scalpel from her hand. The cold weight in my palm snapped me back to reality. Under the light, I steadied my grip. The past is gone. All I can do now is stay present. I set my resolve and made the first incision. To preserve life. That is my role. The atmosphere in the room was taut, focused. The light illuminated my hands. The patient's face was covered by a mask, but I could sense the small life inside her. Incision complete. I stated quietly and moved to the next step. Staring at the bleeding wound, I concentrated to keep my hands steady. Suction. I gave the order, and Ashley handed me the suction tool without delay. Her motion still held a touch of tension, but the fear was gone. I could feel she was giving everything she had. You're doing well, Michael. Ryan's calm voice echoed behind me. It felt like a reassuring hand on my back. I moved on. Carefully observing the detached placenta, I began stitching the blood vessels. To control the bleeding, I needed precise, millimeter-level accuracy. Michael, Ashley murmured softly. Without looking at her, I answered, "It's all right." I could sense her nod silently in response. Her tension eased, just slightly. As time passed, the mood in the room began to change. My hands moved without hesitation, each step exact and assured. Watching me, I could see both Ashley's and Ryan's expressions shift. There was surprise, admiration, and trust in their eyes. "Incredible," Ashley whispered. It sounded like true, heartfelt respect. "You haven't lost it, Michael." Ryan spoke in a low voice. There was a weight in his words that came from knowing my past. When the final suture was complete, I exhaled deeply. "It's done." With those words, the pressure in the room seemed to release at once. The heart rate on the monitor had stabilized. The mother's life had been saved, and the birth of a new life had been safely confirmed. Both mother and child are healthy. Ryan's voice rang out, and sighs of relief spread among the staff. I drew a deep breath and slowly let it out. I realized then that my hand still clenched unconsciously during the surgery. It was so tense it hurt. Thank goodness. The words echoed quietly in my heart. The fact that I had saved a life with my own hands brought me a sense of accomplishment and relief I hadn't felt in years. As I stepped out of the operating room, the pregnant woman's husband was waiting. He bowed deeply to us, his face on the verge of tears. "Thank you. Truly, thank you so much." His voice was full of gratitude and overwhelming relief. A little farther away, Emily stood with tears in her eyes, smiling. "Thank you, brother. Really, thank you." Hearing her words, it felt like the weight I had carried for so long finally began to lift just a little. After the late-night surgery, I found myself in the director's office. The clock on the wall pointed to 2 a.m. The hospital was wrapped in deep silence, broken only by the faint hum of machines in the distance. Ryan picked up the coffee on his desk, took a sip, and looked at me quietly. "Michael, have a seat." I sat down as instructed. As the tension eased from my body, the nerves that had kept me sharp during surgery unraveled all at once, leaving me feeling heavy. "You did well." Ryan's voice was low and calm. "No, I just did what I had to. I wasn't even thinking." Doubt crept back into my mind, the kind that came from picking up a scalpel again after so long. Ryan studied me with a calm gaze. He leaned back in his chair and continued. "Michael, after today's surgery, I'm certain you need to return to medicine." His words came suddenly, but there was no hesitation in his voice. I was left speechless. I let out a long breath and finally asked, "You're saying I should become a doctor again?" Ryan nodded. "You've seen for yourself how much your skills are needed, especially in moments like today." His voice was quiet but firm. I averted my eyes and clasped my hands on my knees. Images of Emily's failed surgery flashed in my mind. The blood-soaked table, my trembling hands. The memory gripped my chest. "Ryan, I almost lost my sister back then." My voice shook. In that moment, I felt like I'd failed as a doctor. Ever since, I've been terrified to pick up a scalpel again. Ryan listened silently and set his coffee down. Then he spoke, gently but with clarity. "Michael, that fear is exactly what makes you a great doctor. Fear means you understand the weight of a life. And today, you overcame that fear and saved one." His words pierced straight into my heart. "But what if I fail again? I don't know if I could ever recover from that." As I let out the fear I had buried for so long, Ryan gave a soft smile and placed a hand on my shoulder. "Everyone fears failure, but doctors carry that fear and still choose to save lives. You faced it today, and you didn't let it stop you. Don't forget that." After a pause, Ryan continued with a new proposal. "Next month, a new hospital is opening. I want you to lead it as the director." "Director?" The words hit me like a wave. I was still unsure about returning as a doctor and now director. The weight of that responsibility felt like it could crush me. I'm not sure I deserve that. I still. My voice trailed off, eyes fixed on the desk. I don't think I'm ready for that kind of responsibility. Ryan narrowed his eyes and smiled just a little. Exactly. That's why I want you to take it. His words tightened something in my chest. I was already scared of returning to medicine. How could I possibly lead an entire hospital? It felt impossible. Please, let me think about it. Ryan nodded quietly and picked up his coffee again. I stood and opened the door to the office. The cold night air enveloped me as I stepped into the corridor. Up on the hospital rooftop, the wind brushed against my hand holding a can of coffee. There were still a few stars above, and the eastern sky had begun to glow faintly with morning light. The memory of the surgery played vividly in my mind. A sensation still burned in my chest, like the lingering rush of adrenaline after a sprint. I could still feel the shape of the scalpel in my palm, and my fingers trembled slightly. I really did it. My whole body was tingling with faint excitement. The intensity of the operation still had a grip on me, making my legs feel unsteady. Just as I took a sip from the can, I heard footsteps behind me. I turned and saw Ashley approaching, her white coat swaying. So you were here. She looked tired, but her eyes held a quiet determination. Standing beside me, she took a deep breath and looked up at the sky. Morning's almost here. That was fast. Her voice was calm, but there was something unspoken in it. I was thinking about the surgery. When I said that, she gave a small nod. I'm really glad you were there, Michael. She looked at me as she said it. But in her eyes, I saw something uncertain. To be honest, I hesitated before the surgery. A few years ago, I was in charge of my sister's surgery, and I made a mistake. She almost died. Ryan had to step in and finish it. I've never forgotten how that felt. She listened quietly. But someone had to act. And out of all the doctors in that room, I knew I was the only one who could. I chuckled softly and added, even so, I was still fighting the urge to run. I kept thinking, what if I mess up again and hurt someone else? As my voice trembled slightly, she nodded with kindness. Anyone would be afraid, but people like you, who carry such a deep sense of responsibility, feel that fear even more. Her words were gentle, as if wrapping around my heart. But when I saw you in the ER yesterday, I knew your desire to save lives is stronger than your fear of failing. Her words hit home. It was as if her eyes could see straight into my hesitation. Honestly, I still don't know if going back to being a doctor is the right thing, I admitted. She quietly sat down beside me. You're not alone, Michael. You can rely on us just like you did during the surgery. We're with you. Her voice was soft, yet resolute. I saw it with my own eyes. Your skills can save so many lives. As she said it, she gently reached out and touched my hand. That warmth slowly began to calm the unease trembling in my heart. Please, return to being a doctor. Ashley's eyes met mine directly, unwavering. I exhaled deeply and looked up at the night sky. The darkness was beginning to lift, dawn was near. Thank you, Ashley, I whispered softly, gently returning the grip of her hand. In that moment, a quiet resolve began to take root deep within me. Rather than turning away from past failures or fear, I would face them, accept them, and move forward. I would walk once more the path of saving lives as a doctor, to stand in front of pain, anxiety, and the weight of life itself without flinching. That is the role I was given, the duty I was meant to fulfill. The sensation of that old tremble still lingered in my palms. But so what? These hands exist to save lives, and they always will. That's what I have to believe, what I must believe. After that, the two of us waited silently for the sunrise. As the sky in the east gradually brightened, I could feel the fog of doubt inside me slowly lifting. Ashley, I've been making excuses running from myself. But today, I finally realized there's still something I need to do. I've decided to return to being a doctor. She looked at me with surprise at first, then quickly smiled with warmth. If that's your decision, then I'll support you with everything I have. From now on, let's save lives together. Her words were sincere and strong. I gave her a firm nod. I'll be counting on you. Let's face this together. At that moment, something inside me changed. The fear hadn't disappeared completely, but knowing Ashley was by my side gave me the courage to move forward. A new morning was beginning, and within me, a new challenge was beginning as well. The wind that morning was cold, but somehow my heart felt warm. I would walk once again on the path of a doctor, saving as many lives as I could.